Hi everyone, and welcome to Lab 2 of Kin 163. I'm excited about this lab because it's often most people's favorite lab as they get into the health professions because it's first introduction to the first steps of working with people. So taking histories and getting questionnaires and forms kind of filled out, but also taking some cardiovascular measures, which can be a little frustrating for some at first, but if you stick with it and practice it, you end up getting quite good at it, and it's kind of fun. So to start off, we're going to take a look at intake forms. So if you've ever been to a physiotherapist or a massage therapist or even a doctor's office, you're likely to have been given a bunch of forms to fill out before you actually go to your appointment and get started. So we're going to cover a handful of those, primarily from the perspective of an exercise physiologist or a kinesiologist or someone working in personal training in that area of the health field. However, the same ideas and principles apply across the health professions. Then we're going to take a look at pulse and how to take a pulse and what sort of information you can gather from that. Then we're going to get into taking people's blood pressure. And again, this is something that a lot of people find fun and kind of interesting. You see many people in the health profession do it, doctors, nurses, and kinesiologists, and learning how to do it and what it's all about and the information you can learn from taking someone's blood pressure is always interesting for a lot of people. So let's dive into the questionnaires or the intake forms. To just set a bit of a mind frame heading into this, again, you'll be going through these questionnaires yourself in a bit more detail just to see what they're all about. But ultimately, what you're trying to do here is gain a picture of your clients or your patient or the person you're going to be working with. And one of the easiest ways, as far as efficiency and perhaps having the most rigor kind of behind it, is these questionnaires. And you're really trying to get a health picture painted of your clients or patients. So why do we use these? And they used to be called pen and paper questionnaires, but now clearly it's mostly electronic. Again, if you've gone to a physio or a massage therapist within the last few years, it's typically online, and I would imagine even so, more so these days. So again, one of the main things that we can gain from using these assessments, like why even use these, you end up talking to the healthcare practitioner, explaining your story and what you have going on anyway. Well, one of the reasons is you get insight from your client or patient before you even see them. So before they even walk in your door, before they walk into your office or your clinic, you can already have a really good idea of what's going on with them, what's troubling them, and potentially once you get enough clinical experience, you actually get a really good idea of how the treatment session is going to go. So you can kind of pre-plan a little bit on that end of things as far as being able to figure out how you're going to support your clients and patients, which is great. Helps make things really efficient. Secondly, these again, pen and paper forms or these questionnaires and health screening, they're really valid typically. So most of the time, if there's a well-established screening protocol, procedure, form, or something like that, they're going to be studied. They're going to be studied well. And if you're ever curious about it, you can always look it up. There's a handful of good databases that are available online where their whole function and purpose is just to set up healthcare practitioners with information about how valid and how reliable these questionnaire forms are. And the third thing with the reason why you want to use these screens is ultimately they're safe. They're non-invasive. So some tests, even as simple as having your, say, finger pricked when you go to donate blood, or um, having a cotton swab, let's say for COVID or something, up the nasal passage, is technically invasive. So anything that passes your skin barrier by any means is definitely invasive. So luckily, with these questionnaires, you can gain so much information and health information about your clients and patients, again, without even needing to perform any tests on them. There is a small factor when it comes to taking any questionnaire or survey with people. This comes from research, or even in a healthcare setting. Uh, it potentially makes people feel a little bit vulnerable. And what I mean by that is they have to share personal information with you. And sometimes for people, that can stir up some psychological distress, even if it's minor. So it's good to be mindful that when you're asking these questions on a screen, health screen in particular, sometimes people are embarrassed about their health, or embarrassed about their answers, or what an honest answer would be. And so they either answer honestly and feel very vulnerable about that, or they try to protect their egos and maybe lie. And so having to lie makes people feel bad. So again, when you're in a health setting, it's really important to try to be mindful about people, and what sort of slightly negative psychological effects that even something like a pen and paper or questionnaire, health screening questionnaire, might do, or what effect it might have on people. So with that, why, why use them if there's this little bit of risk, even if it's small, that some people might experience some psychological discomfort from answering these questionnaires? And really, at the end of the day, it's all about safety. All screening procedures and intake forms and everything, it's all about how can you best keep your client or patient safe while performing whatever healthcare practice you have. It's a very cornerstone aspect of the healthcare practitioner's doctrine, is to do no harm. One of the best ways to do that is to gather enough information about your patient or client and make sure that you do no harm. So this is why we collect all this information through these screening forms. And something to pause and consider. If you remember back to last lecture, we covered the standard distribution curve, so those bell curve things. And if you recall, one of the important parts about those curves was it gives us a good idea where 95% of people are going to be in. So again, if you consider that and how research is done, and that is definitely how these screening forms and data is collected as far as any health screen, there's always a balance between sensitivity and accuracy of these tests when you're performing it in a health setting. And they all have a potential, if you can imagine, where somebody is going to fall maybe outside of that 95% or 90%, or however accurate this test is. And so, again, these screens aren't perfect. They're not necessarily meant to be. But the premise is the majority of these screens, even the written ones, are really meant to be in place to ensure that people have the best chance to be protected and not be harmed when, for example, they start exercising. So some common questionnaires. The ones that are posted for this class, and the majority of them that you're going to be looking at, are all from a organization called CSEP, or the Canadian Society of Exercise Physiologists. and they're pretty much the gold standard when it comes to exercise physiology, kinesiology, personal training. They in Canada in particular. So when you go through these forms, and we'll go through them in a second. The idea isn't you don't need to memorize everything about them, but definitely experience going through them yourself. One, just to see where you kind of arrive, what sort of conclusions or scores that you come to as far as your own maybe health or readiness, which is always interesting. But also keep in mind what it would be like for someone who has never exercised to go through these forms, or someone who might be much older and in poor general health and well-being than yourselves likely are, or conversely, what someone very healthy might be. And you should get a sense of the information that you could potentially gain as well if you yourselves were a kinesiologist or personal trainer or doctor or physio, and can picture how helpful these might be if you're to start working with someone who you've never met before. Here we can start going through some of the forms together, and again, I'm going to be a little bit brief. You have these at your reference, and you're going to be going through them on your own, so we don't need to be super detailed, but some of the main points here I definitely want to cover and highlight for you. So if we take a look, the first one typically that you would give in a, say, exercise setting would be something like the Get Active questionnaire. Now this has a counterpart in other health organizations called the PAR-Q. So you might be familiar with that, PAR-QX. There's a few different variations. Ultimately, what this Get Active questionnaire is about is screening for major health issues that might become an issue when people start exercising. You do hear stories of people who run a marathon and die during these marathons, or a triathlon or something like that. And usually that's because people have a pre-existing condition, heart condition, that they may or may not know about. But to do these races, you don't need to have, say, a coach or a physiologist working with you. But if you did, they might have you go through one of these questionnaires, and you might actually be able to get around one of these issues, such as unexpected health complications, such as a heart attack or death. So that being said, we'll again think about that when you're going through this and the different health issues that this might screen for. So again, we kind of a yes or no. We're trying to keep it simple and accessible to most people when you go through a form like this. So again, yes or no, yes or no, yes or no. And we get to the bottom, and sure enough, there's one that says if you have a yes, you need to go to a reference document for any of them, and gives you advice where to go and what to do next. If you have no to all of them, you get to continue on. So immediately, any of this, if you get a yes, again, it's trying to keep it simple, but you got to go on and try to find some other help. Continuing on, CSEP, you can see that CSEP right there has a really good form where it's trying to already get some information for you as, say, a kinesiologist or exercise physiologist, trying to get some background information on how active people are, some general advice on how to become more active in a safe way, and then a declaration essentially signing and consenting to any health issues or not. And a lot of these PAR-Q and generally a lot of screening forms, they'll come with a reference sheet. And what I mean by that is something like this, where if you have a reference document, this is essentially if then. I don't know if anyone would know, but they used to have these books, these adventure books that you could read, and essentially it tells a story. You read part, like a page or two, and then it says, what are you going to do? And at the bottom of the page it says, are you going to go into the castle, or you're going to go over to the bar, the tavern. And in this story, you can say, okay, well, I want to go to the tavern because, hey, let's get some ale, right? And it'll tell you go to page 12 or page 30 or whatever, and you flip to that, and then the story picks up as if you'd gone to this tavern. And so you kind of jump back and forth throughout this book depending on your choices that you've made. They're really fun. I don't know anyone who hasn't purely skipped the story and just worked backwards from what one of the endings are, as I think particularly as kids. But these forms are kind of similar in the sense that there's an if then, So you follow along, and sure enough, if you had said yes to something, it leads you to here. For example, this is pertinent to us in our class because we'll be taking blood pressure. So if you find out that you have a resting blood pressure of 160/90, again, you'll understand better what that is towards the end of this lab section. You'd say yes, and then here's some directions on what you should do. The gist of this form is exercise is probably going to be good for you, but you need to check with your physician first to see if you can undertake that, which is pretty standard, I think, for a lot of health conditions. So here we are. Sure enough, CSEP's been great. They send you a little physician physical activity readiness clearance. And more or less, if anyone has a condition, typically they need to go to their doctor. Some docs will give specific guidelines, heart rate not over this sort of activity, avoid this activity, whatever it might be. But most of the time they'll do their own screening and make sure they're not missing anything, making sure people's medications are adequate for when they start exercising. And then they sign this through. Again, progressive physical activity, they'll kind of give their specific guidelines, and then you more or less as a kinesiologist or exercise physiologist follow that. And the same thing will be in this class. So you will, if you go through these forms and need a medical clearance, my suggestion would be definitely try to get a general practitioner on the phone, or even do an online appointment, as I know some are doing. Whatever's quickest, safest, and easiest for you, and just get clearance for it, because you will be expected to do some physical activity yourselves in this class. Okay. More directions. That's a nice thing about an established screening rather than making your own, is you have that as extra information and background. This is more supporting information, as you'll find out. So the which one is this? The PASPQ is just generally looking at what your current physical activity is and how sedentary you is. So sedentary means inactivity or sitting, or lack of physical activity would be antonym to it. So as a lot of research is finding out nowadays, is you could be rather high levels of exercise, so specific activity to get your heart rate up or perform some sort of fitness. However, if you have a high level of sedentary activity or lifestyle, so say working in an office, or a long time of sitting and doing nothing, playing video games, watching TV, etc., this actually it almost nullifies a lot of the general exercise you might be doing. So it's really good to try to be physically active, and this will help you gain a better picture of your clients or patients. So looping back a little bit to the screening for medical conditions, the great thing, and there's a class later on in kinesiology about this, is really anyone, despite their level of disability, can be active in physical activity in some capacity. Usually it just requires a little bit of modification. So highly suggest if you can take an upper level in adaptive physical activity. I highly suggest it. It's a really, really great class, and really great at figuring out how to keep sport and physical activity inclusive for people, even if they have, say, the partial blindness or missing an amputee or whatever the case may be. So this partially gets into that realm and allows you, again, early on, before you even see this person, get a great idea, a great picture of how you might approach working with this client. And then I believe last but not least, typically you want to get some form of informed consent. So what is informed consent? If you've seen an episode of House ever, great show, good fun, but obviously House skirts around not getting informed consent a lot. And in the show, because he saves people's lives, people just suddenly forget that he's gone around this sort of very extremely important aspect of medicine and healthcare. So why is this important, and what sort of aspects of informed consent are there? Well, there's 8 main things that typically informed consent utilizes. But generally, some of the more important things are informing people about the potential risks, and that being said, the benefits to undergoing whatever procedure or exercise or program that they're about to do. They also let them know that it's voluntary, which is really important. It's more so important when it comes to, say, like research and stuff. As a participant in research, at any time you can just be like, this isn't for me, and duck out, and that's really just to ensure everyone's comfort and knowing willingness that they can, obviously stop if they want. Yeah, and there's a few other points too. I'll put up just kind of in a little window somewhere here that you can look at, but those are really kind of the main things, and so ultimately you're giving people the free choice and the freedom to be able to participate or not participate in this activity, and that's really important. So after this, we kind of step outside of the mostly typical assessments that we get for people. We kind of start stepping into the realm of extra ones. So we have a sleep quality index here. So again, just trying to get information. Everyone knows how important sleep is. There's a really well done study that's recently come out that just helps illustrate just how important getting enough sleep is. Essentially, it's when your brain starts repairing itself. So just going through your day, metabolism and different things, essentially just using your brain causes little micro injuries and stuff to it that occur regularly. And sleep is actually one of the main times, in particular REM sleep, where you get some time to be able to repair it. So definitely an important aspect of health. And pregnancy, so this is important as well. You can exercise, and there's definitely certain special certifications that different exercise organizing bodies will provide for you as practitioners to ensure that you get essentially have yourself covered and knowledgeable and able to work with women that are pregnant, because they definitely require a special considerations. We've now taken a little bit of a look at essentially the client or the patient just giving us information. Okay, we haven't even seen them yet. Maybe we have. Maybe we've gone through those sheets with them or those forms. But now you get to take some sort of objective measure, right? So again, maybe people haven't had any issues yet. They don't know anything. And you're one of the first people that are performing this health screen or intake with someone. And so the great thing is you can now, after this, have the capacity to take what's called like an objective measure. So an objective measure is essentially when the person has no influence really. They don't subjectively say anything. It's not their perspective. You just objectively measure them. Okay. So for pulse rate, there's a few different things that you can do. And really the first off the top, just to clarify things, what is a pulse rate? What's a pulse? Well, it's your heartbeat. So every time your heart contracts, it pushes blood out through the aorta and into the rest of your body. And so as it goes down your arteries and veins, essentially what you feel is a little increase or a little pulse, right? A little boom, boom, expansion of your arteries, because it's literally getting pushed a new little volume of blood that comes through. And then, of course, as the heart relaxes and opens, kind of pulls in more blood. So that decreases the volume of your blood that's going through your veins and arteries in particular. And then your arteries expand again with a pump, and then relax a little bit with the heart relaxing. So that's where the blood volume goes. So you can kind of think of it that way. It's not 100% exactly as it happens, but it's a good place to just kind of picture it and imagine that's the way it is. So one of the first places that you can check out your radial pulse, or one of the places we'll be using, is your radial pulse on your wrist. Okay, so using the side, if you go to the side with your thumb, you have your two bones in your forearm. You might remember from last lab. So you have your radius and ulna. So your ulna is the one that goes over your elbow. If you remember that, has the olecranon process, and it comes up. The other one, in the other forearm bone in your arm, is called the radius. So as you, the way I remember that is if I have my hand here, it's the thumb side, right? So I'm trying to get in the screen for everyone. So if you hold your hand out and you turn your hand kind of back and forth, the ulna side stays more or less in place, but the one with your thumb, the thumb kind of pivots around back and forth, even though the ulna stays in one spot. So it radiates, it rotates, it radial rotates back and forth. So that's your radius. That's how I've remembered it. It's definitely helpful to come up with your own sayings and acronyms and whatever it is for body parts. So explore and have fun with that. So you'll take your forearm or someone else's, you take your two fingers and you essentially move them around until you get to a point. Sometimes you have to press a little bit harder, press a little bit lighter until you feel the bump, 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 bump. Or it might be a little quicker for you, might be a little slower, but essentially you're waiting to feel that pulse or that throbbing that's coming from your artery. So if you're relaxing your wrists and you have your fingers over top, you essentially set the clock on your watch for some duration of time. It'll give you instructions in your lab manual, and you count and watching a clock, because you can't count seconds and count pulses. It's just, you can't do it. It's too hard. Okay, and you'll try this on other people as well, hopefully close at hand, and get lots of practice at it, because you'll come to find that a lot of different people have a lot of different places. There's a good majority that you'll find in the same spot, but it's just definitely good to practice. Now, you might also think and realize that there's a few other places on the body where you can take a pulse, right? So one's the neck. There's another one on the inside of the thigh, actually, where you can get your femoral artery. There's another one in the arm, the brachial artery, which is just kind of under your armpit as well. So one of the reasons that we typically don't go to the neck with people is when you go to the neck, there's a place in here and a reflex that can occur if you're rooting around and looking for quite a bit. One, if you're pressing too hard, you kind of can bother the airway a bit of your client or patient. But the other thing too is you can actually cause this nerve stimulation. There's a nerve that goes to your heart that can slow it down. And so kind of by massaging up in the neck, you can actually lower your heart rate. And if someone is already, for whatever reason, maybe has low blood volume or pressure or whatever as it is, and you start rubbing the neck, that's going to bring it down farther. Potentially someone can faint. The other reason is too, if you don't ever have two people or try both sides of the neck, because again, people can get lightheaded. So yeah, you don't want to cut blood flow off to people's brains essentially. And so yeah, we use the radial pulse most of the time. Another way you can get someone's heart rate or pulse rate is through a strap. So this biometric or telemetric kind of data comes from a heart rate strap. You see in the illustration here the good way and the not so good way to place them. You'll want to, if you remember the xiphoid process that we went over on the last lap, is like right at the bottom of the rib cage, right up in the middle of the tent. Typically that lines up really well with where you want the module and the heart rate strap. Okay, so I got one here, and you should have ones purchased as well. So mine's Polar. I like Wahoo quite a bit. Doesn't matter what brand it is. No, they're all going to work hopefully the same as long as they're a decent, well-known brand. Some have a little module that come on top of it that you can peel off. You just pop it right off. So you have the strap and the little electrodes in the module, and you put it back on. Okay, so when you put it on, you want it to be logo up, and place it just below the chest line. And you'll also want to ensure if you have a sports bra on or something like that. Typically, I suggest for a lot of my clients that it goes just under the bottom of the band. So it actually helps hold it in place a little bit, especially if you're being nice and active. Keeps the backside with the electrodes where the back of the pod is held against the body. The other thing you want to do before you start measuring is actually get the back wet. It doesn't take much. You take a wet cloth or a towel, kind of just get it damp and moist, and that helps. And here's why. So the reason all of this position, setting it up correctly, putting some water on the back of it really helps is the module and the electrodes pick up every time your heart contracts. So every time your heart contracts, it uses actually an electrical signal running down a nerve bundle and nerves in your heart to tell it when to contract. So a nerve pulse goes and the heart contracts. Now, what that means is this pod, these electrodes pick up every single time that electrical signal is sent. So it knows quite accurately exactly when that heart's beating because of the electrical pulse, and it picks it up quite directly. Why not use a smart watch or a sport watch or a activity tracker? So a lot of watches nowadays, they'll have the heart rate capacity done through lights. So if you ever take mine off here, if you ever take a look at the back of the sport watches, you'll probably notice something like that. So right here, and I don't think it'll turn on, unfortunately, yet, but there's 3 lights. And typically what they'll do is they pick up the changes in the color of your blood as it passes by the lights. So for example, every time you have a pulse of blood, when there's no blood traveling through the artery, these lights pick that up as a certain color. And then the color changes as the volume increases through the artery in your wrist. And so again, the way it kind of tracks is that color change. So what that means is you are getting an indirect measure of your heart rate. And so compared to the telemetric or the biometric strap, heart rate strap, which is a direct measure, it leads to a greater capacity of error, so it's less accurate. So that's typically why the strap is preferred over the watches. Now, are they getting better and better at tracking heart rates, etc.? Yeah, they are, and it's good to a point. But ultimately, if you can directly measure something, that's the way you want to go. Next up, you're going to be learning about blood pressure and learning how to take someone's blood pressure, which is really cool. It's lots of fun. It's a little challenging. It's a skill that needs practice. And on top of that, for this class and for this lab, you're going to need to know what you're doing while you're doing it. So what are you actually measuring in someone's body as you're gaining all this information through taking someone's blood pressure? So to start, we'll kind of figure out what is blood pressure. Well, blood pressure is what it sounds like. It's the amount of force that pushes out onto the cardiovascular system by your heart, and that has a few implications farther down the road for health. So when you have pressure in your arteries, and that's typically what we're going to be speaking about. Arteries are the blood vessels that carry blood out away from the heart. Veins are what brings the blood back to your heart. Arteries are more what the pressure-based ones. So what we're going to be measuring through that is two ends of your blood system's pressure. Okay, so you have this force on your arteries pressing out as the heart contracts. So if you think about it, lots of force. It's a big pump, muscular pump, shoots out all this blood. You got high pressure heading out to the body because it's got to get all throughout, all the way from your heart to your toes to your fingertips, definitely to your head, right? Tip of your head. So that's going to be the highest amount of pressure your body experiences as far as its blood pressure. On the other end, we're also going to be able to get the number for when your blood pressure is lowest. So heart contracts, boom, big blood ejection out from the heart. Then the heart relaxes. So as the heart relaxes, it relaxes the pressure on the blood on your arteries by becoming larger. It increases its volume, and then your blood pressure comes down because now there's more space in the system. So again, it brings that blood pressure down, and that's the lowest number. So again, contraction, biggest number, relaxation, lowest number. Okay, so they have two terms that coincide with that. It's systolic and diastolic. So systolic is a number when you have high blood pressure, big contraction. Diastolic is during the refilling or the relaxation stage of the heart. So that'll always be your lowest number that you get as far as blood pressures, okay? To do this, to take blood pressure, we have some special tools that we can use, most of which you've seen. So first off will be the stethoscope. Now yours might not look exactly like this, but we'll cover a few features of it and what's typical of most stethoscopes, okay? So first off, let's look at the front end. We'll look at the drum. So mine has two different sides. One's larger, one's smaller. Again, everyone's just a little different. This side is actually for pediatrics or infant. So you'll notice it's smaller than not. This is the head or the drum of the stethoscope. On this end, you'll notice it's larger, flat. Again, this is more for the adult side. One of the important things to remember while you're first starting out with a stethoscope is that there's actually an on and off, okay? So you take the drum and you essentially rotate it. So that could be on or off, and I'll show you how to check for this after. And then you rotate it back again. I didn't move this, okay? So that's that end. That's the part that's going to go on the person to be able to auscultate or listen to them. And then the other end is the earpieces. So with these, you want to take a look at them, and you'll notice, okay, there we go, that they actually have a bend. So that one's a bit better. So what you want to do is the curve on them, you actually point forward. So it's going to point forward into the ear. Some people might be tempted to have them point back into the ear. You want to have them point forward. Okay. So from here, what you can do is you can carefully check to see if it's on. So to make sure the stethoscope is on, you very lightly tap the drum. You should hear tap, 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 tap in through the earpieces, okay? If it's off, you're not going to hear anything, okay? So that's important because as you're learning to take your blood pressure, if you're trying to hear things and nothing's coming through and you're trying to figure out, you're listening really close, so there's some very subtle sounds, you're just going to want to make sure that you can hear, okay? And so that's the stethoscope, and those are those sides. The other thing is a sphygmomanometer, which is a super fun word to spell and say. Highly encourage it. But you might know it as a blood pressure cuff, okay? So that's this thing, all right? So you're going to have the meter to read the blood pressure, which is always in mmHg, which is millimeters of mercury. So it's a way to measure pressure. And the cuff itself, which has Velcro, will typically also have instructions on it. And again, these are always a little different. Mine likes to tell me here where the arteries are, and usually on the inside it'll tell you what sort of range. So there's different sizes for children, infants, and adults, and there's even different sizes for adult cuffs as well. Okay. The other part too is the bulb and the valve, okay? So again, if you want to double check to see if this is open or closed, typically on the side, if you screw the top all the way to one direction, you can usually see a little hole, like a pinhole, where the air is going to come out. You can very lightly just spin it the other way, and it should cover the hole, and you should see it. When it's closed, it's going to pump up and inflate the cuff. When it's open, it'll deflate it, in particular if there's pressure on the cuff, okay? And that's the tools of the trade that you'll be using to take blood pressure. We're going to switch to kind of seeing the anatomy a little bit first, so what's going on. Again, I highly suggest taking a look and reviewing the tutorial that's linked to this, both in the video and also within your course content under the learning module for this week. It really helps explain and connect when the blood pressure is going up, what the cuff is doing to your artery and your blood pressure, what you're listening for, what you get to hear, and then where you generate the numbers for systolic and diastolic. Here is, again, a little bit of the anatomy of what we're going for. I had mentioned it earlier that the brachial artery is a place where you can find your pulse rate. And so here you go. Here's a bit of a diagram. This is a person turned sideways, so you can see someone's ribs here. Their head would be here in the corner. They'd be laying down sideways here in this. I just wanted to be able to show the full length of the arm. So the blue part is where you apply the cuff, and it's going to inhibit the blood flow to the rest of the arm. So when you're doing these, big safety alert, should have some graphics or something fly up there. Don't leave the blood pressure cuff on for any longer than, let's say, a minute at absolute most if you have to, okay? Why is that? Well, you're going to be cutting off the blood flow to the rest of the person's arm, and that's not good. That can be painful. It can cause some damage, injure the person. So again, try to be mindful. If you're having the blood pressure taken to you, always speak up if you feel like your arms has had the blood pressure cuff on too long, okay? This green arrow is actually roughly where you're going to put the stethoscope, and I find this really helps. Being able to see roughly where the artery here in red is going, how it relates to the landmarks, and where roughly you should be trying to hear the blood when it starts to flow through again when you take someone's blood pressure. Now, it's not always going to be exactly there. People kind of have a better place than others to hear. There's always individual differences, right? So if you kind of notice on this graph, you have your epicondyles here, your humerus that stick out and is roughly in line with that. But again, sometimes people's arteries are kind of tucked behind their biceps a bit more. Their forearm muscles are a little large, and it's really hard to get a good sound in there. So it'll take practice. So make sure you practice this. Okay, in the end, if we're going to pull everything together from this lab, ultimately you have a really great start towards the intake of a client or a patient. And one of the things you can do with these is obviously you have your questionnaires. So they serve two purposes, both pertaining to safety. One, you get to screen, based off of these studies and research done with these screening questionnaires, any major health issues. And you kind of protect your clients and your patients with that. Secondly, they are non-invasive, and you can do this before you even seen your client. So you get a really good idea and a really good picture of who is this person purely from these questionnaires. The other part, once you get this information from the questionnaires, is the objective measures of pulse and blood pressure. And with those, you can proactively measure someone to help screen them off of a obtainable measure that they have no say in, really, as far as an indication of their health and well-being. And with that, you're well on your way to obtaining all the information you need to start off with someone to get them going on an exercise program. You'll notice in our next labs, though, you'll get more and more information to help refine that. Okay, well, have fun essentially practicing taking someone's blood pressure. I highly suggest you do that quite a bit before diving into submitting your lab activity of blood pressure. And similarly with the pulse rate, it's really good to just practice it, figure it out on yourself as well as anyone around that's a willing participant. Okay, have fun with that.